The Medical Minute, bringing you up-to-date medical knowledge for healthier living.
Good morning. It is 7:25 on your Monday, and it's time now for our Medical Minute. I am joined by Dr. Shaun Gillis with Bozeman Deaconess Women's Specialist. So thanks for joining us this morning.
Thank you for having me.
And today we're talking about the first GYN exam. So can you tell us a little bit about the importance of the first GYN exam?
I can certainly tell you a little bit about that. One of the things that I get asked a lot is, when should my daughter come in for her first GYN exam and why? What is the point of starting early? And the American College of Obstetricians and Gynecologists recommend that somewhere between 13 and 15 a young woman should come in for her first gynecologic exam. That doesn't necessarily mean it has to be done by an OB/GYN. It can be done by a pediatrician if they're comfortable with that age range of young women. It can also be done by the patient's family practitioner. So it's basically just a chance to start addressing some of the things that are going to be coming her way in terms of, becoming a young woman and then into young adulthood. Things to think about are her health history, things that are going to potentially impact her future health risks, vaccinations, because that's where a lot of people end up falling out of the vaccine schedule, is sort of that age range. And then also to start talking about menstrual periods, if they're having any problems with that, any questions about sexual intercourse, sexually transmitted diseases. A lot of those things start coming up around that age range, and it's probably nice, I think, for young women to not only be hearing things from their family, but also to have a physician involved in that time in their lives as well.
Okay, and how can someone prepare for their first exam visit?
They definitely need to talk to their family and get a good, solid family history that they can bring in with them. They can bring in their own health history. That would be good. Their vaccination schedule, any medical problems that they've had. They should be prepared to talk about some sensitive information, things they're probably not used to talking about with their physician necessarily, in terms of puberty and acne and menstrual periods and any problems with that. And then we also start delving into things that they're going to potentially be seeing in the future in terms of risky health behavior. So if they feel nervous or they just have a lot of anxiety about coming in, they can certainly bring a family or a friend with them, a family member or friend, and they definitely need to let their doctor know if they're nervous, because there are a lot of things that we can do to put them at ease in that first exam. And it's not always even a pelvic exam. A lot of times those first visits are just discussions. So.
Okay, thanks. And you can find more health news on our website, kbzk.com. Thanks for joining us this morning.